Dr. Bachnight, tell us how hospice first began in Victoria and how you got involved.
Well, the first decade, I came to Victoria in 1972, and I had some training in oncology, and there wasn't anyone else that did oncology in Victoria. Well, except maybe one, Dr. Hicks would do a little bit, but he was happy to hand it over to me. So what happened, I noticed over the first decade of practice that there was really not any way of caring for people. And you have to remember, back then we had family physicians that they took care of their patients, and they would go out and make house calls. They took care of the patient in the hospital. Anyone that passed away at home, you had to go out and see them and pronounce them there, or in a nursing home. You went out. Twin Pines was out at the airport at that time. So you had to drive out to the airport, pronounce them, because nurses could not pronounce anyone deceased. So there was a lot of different type of care, more hands-on care by the family physician. So I noticed one patient of mine who had cancer of the lung, who was doing much better and was going to pass away and did not want any further treatment, that I made house calls on him. And I noticed his wife took care of him, and it got more and more difficult for her. They were in their late 60s, early 70s. So at that time, they called me about 2 a.m. I drove over to the house, and he had passed away, and I pronounced him. Time was given. And I looked at the wife and her sister, and they just looked so tired. And I looked at them again. I said, "I'm so sorry for your loss. And is there anything I can do for you?" They said, no. Finally, he's at peace, and we can finally rest. We're so tired. And then I got to thinking, there's got to be a better way. And so I started looking and thinking about hospice and finding out about it. And then that's sort of when we started thinking about it.
So Dr. Meyer, with regards to end of life and care now, how is it different, or how is it much the same today in your experience?
I think we've learned a lot about how to care for people during these stages as they're facing terminal illness through research, through trial and error over all these decades.
Right.
So I think we have more tools to care for people, not just medicine, but the interventions of all of the hospice staff. You know, the team is interdisciplinary for a reason, because it touches on all of those things that patients, but their families especially, deal with. And we've been able to fine tune that and deliver really good quality care to people when they need it the most.
In both of your opinion, how have the myths around hospice and what hospice is and isn't changed? Dr. Meyer, what are still some of the barriers or stumbling blocks?
Now, hospice is a weighty word, and it's a scary word if you're not expecting it, or even if you are. So it takes gentle discussion with patients and with their families to what it really means. We're not asking you to give up hope. We're asking that, we're suggesting that hope change. What we're hoping for changes. The cure may not happen, but quality of life can still be there. You can still make memories with your family, enjoy that time, make the most of it. And that's what hospice offers.
Dr. Bachnight, what would you add to that conversation?
Well, I think I used to always think about hospice as or the time of death, to make sure it's a good death, without pain, without suffering, if you can relieve that suffering. And to me, I always think of it as like birth. Birth, we have an APGAR score, and the APGAR score, you want it to be 9 or 10 or it's 1 to 10. So I think we need to look at the other end of life, at death, and can we make that a peaceful death and have a good outdoor score for death?